Be muted, and any questions that you have, please make sure that you ask them in the comment box so we can make sure to address them. So on our panel tonight, we have Commissioner Michael Conway. He is with the Department of Insurance, and he was appointed, sorry, I just lost his bio, but he was appointed by Governor Polis, and he has extensive experience in the insurance industry, and we're grateful to have him as a panelist tonight. In addition, we also have Representative Carrie Tipper, who is from House District 28. She was the lead House sponsor and a big driving force behind the Colorado Building Families Act. In addition to that, we also have Betsy Campbell, the Chief Engagement Officer of Resolve. And we are excited to have you all here tonight, and thank you all for being here. So I have a list of questions that were submitted prior to the webinar beginning. So I'm going to go ahead and start with those questions. And then panelists, if you would, I'll direct the question to one person in particular. And then if anyone else would like to chime in with additional information or tag-ons, please make sure to feel free to do so. So the first question we're going to start with is, and as everybody probably knows, the Colorado Building Families Act passed during the session of 2020. Thankfully, with some really incredible support from the DOI and the governor's office, we were able to sneak it in right before the COVID shutdown. So we're grateful for that. And with the original bill date coming up January 1st, 2022, we wanted to make sure that everyone who had questions had the opportunity to get some answers from some of the critical people involved in making of this law. So our first question is there any work or movement to readdress the defrail interpretation with the current administration and see if they have a more favorable interpretation than the prior administration? So if everybody is not familiar with that, I'm going to let Betsy take that question because that is a federal level question regarding the interpretation of the Colorado bill and HHS at the federal level.
Right, right. Thank you for that question. So there was a provision within the Affordable Care Act that was strengthened by the previous administration. And as a result, it frankly was, I think, designed to make states nervous about adding new insurance mandates. And because it actually was going through and being sent to the states right as our bill was winding its way through the legislature. The governor's office and Division of Insurance asked, suggested or gave us language to include that if for some reason this was considered to exceed the essential health benefits, then the individual and small group markets would not be covered. It would only go into effect for the large group markets. So there was, I think, some communication between HHS and the state. And I think the state didn't, and Commissioner Conway, I'm going to let you also share because I'm sort of reciting third hand in a way, but they just weren't comfortable that the state that there wouldn't be any risk to the state. So that's why right now the plan is that this will not cover the individual and small markets. However, Resolve is working on this issue with the American Society for Reproductive Medicine. We do not interpret the ACA the same way. And fortunately, we have been able to retain some federal lobbyists to help us work to correct this and to make the provision much, clearer so that it won't, frighten the states. So actually the Biden administration postponed enforcement of that provision, but because it's in the Colorado law, we still have to behave as though it still is something to address. But we, look, the intent of the law was to cover as many people as possible in the individual small and large group markets, and we will work at this until we get all those people covered. And I think my panelists would agree that we won't stop until that happens.
Yeah, and Crystal, if I can, just to jump in and kind of unpack things a slight bit more for folks. So the reason why the defrayal piece is in the Affordable Care Act is because the Affordable Care Act subsidies are tied to the price of health insurance plans. So as health insurance plans go up, the federal government pays more in subsidies to consumers. So they put this piece into the law back in 2010 when it passed really as a budget item because they were concerned that if they didn't have this kind of protection for the federal government's budget from their vantage point, that states would increase mandates and then the federal government would be on the hook in the individual market for the subsidies and relatedly in the small group market for tax credits. So, but Betsy's absolutely right. Up until 2019 was when the Trump administration first proposed this regulation that Betsy was talking about, that was going to require the states to actually tell the federal government what new mandates that they had put in place after the passage of the Affordable Care Act. And then as a result of that, that's why we started the conversations about making sure that if the federal government did say that we were going to have to defray the cost of this benefit, so to unpack what that really means for folks, what it means is that the state would have to pick up the cost of any increased premium in the individual market or the small group market for everybody enrolled in that in those marketplaces. So we had the language written into the law to make it clear that if the federal government came and told us that we had to defray in the individual and small group market, that it wouldn't go into effect in those two markets. And then there was also a requirement for us to write into the federal government with, I think, 120 days, if I remember correctly. So that was where the conversation went with the feds, with the Trump administration. They wrote back to us, we wrote in and we made an argument, our argument as to why we didn't think that this was a new mandate, that it's required effectively for a couple of different reasons. But HHS disagreed. And they wrote back and said, well, we think this is likely going to be a new mandate and the state would be on the hook for defrayal. The interesting component, one of the many interesting components involved in that, though, is that we know there are a number of other states, obviously, that have passed this law, that have a similar law on the books in their states. It's a very open question as to what the Biden administration is going to do going forward with both this benefit, with this or any other new benefit that the states have put in place. They've at least given indications that they do, although they've delayed the enforcement of their regulation by a year, that they do plan to keep it on the books and move forward with it, but that could change too. And if the regulation goes away, then that changes things a little bit for kind of how we would march forward. The other piece that I just need to put on everybody's radar is related to the large group market. Betsy's right that it was fully the intent to have this apply in the large group market, even if the feds came and said, then in the individual and small group market, that we were going to have to defray. Unfortunately, after many lengthy and long conversations with the Attorney General's office, and we can get into kind of the weeds about why the Attorney General's office is a very important player in the conversation. They have come and told us that they do not believe that the law is clear enough that we can apply it in the large group market via regulation, because that's what we would have to do, unless we clarify that the law is intended to go into effect for the large group market, even if it isn't going into effect in the individual and small group market. So I just kind of threw a lot at you, and I think I lost Crystal. Where'd you go?
I'm still here.
Oh, there you are. So I don't know if I jumped ahead on some of your questions, but I just wanted to kind of put all of those things out there for folks.
You're good. We'll lead into some of those other questions and points as well. Thank you both very much. So one of the questions for you as well, Commissioner, and Betsy, if you have anything to chime in as well, is Once this law does come into practice, how will I know if my particular insurance company will pay for fertility treatment? And then if they are unaware of this law, who can I refer them to for further information?
The easiest way for folks to know is for all insurance plans that we regulate at the Division of Insurance. It says on your insurance card, so that little card that you've got in your wallet, there's in the top right corner, depending on the insurance company. Anyways, on the front of the insurance card, it will say DOI regulated plan on the card. If that's on your card, once the law goes into effect, then it's covered. There was a question in the chat about the Erisa markets. The law won't apply to the Erisa markets. So those big kind of large employer self-funded employer sponsored insurance, the law doesn't, none of our state laws apply to the Erisa markets, to the self-insured employers. It's frustrating. Valerie, you're absolutely right. It frustrates the crap out of me. And if we weren't being recorded, I would have used a different word. It's incredibly frustrating that when we run into these types of issues, the things that we think are important, protections for Coloradans just in general, and there's a whole subset of the marketplace that we can't touch. But we are preempted by the federal government for all self-insured products.
Yeah, and I'll just add, if you're wondering, why your card may or may not say DOI, we usually suggest that people ask 3 questions, and that's, is your health insurance controlled by Colorado? So for example, you may work in Colorado, but your employer is headquartered in another state, and that's where they draw their insurance. Or there may be multiple headquarters in addition to Colorado, and perhaps they draw their insurance there. So if they are headquartered or draw their insurance in another state, that would be a reason why your card isn't marked with that it's controlled by the Colorado Division of Insurance. Also, you need to ask if your employer is fully insured or self-insured, and it may not be obvious because even self-insured companies often are managed by Aetna or United Healthcare. So you actually need to ask whether it's fully insured or self-insured. Typically, companies with 500 or more employees are self-insured, and I believe in Colorado, the large group market is defined as 100 or more, but that's in the fully insured market. And then again, that's really the 3 questions for the large group market when we get this issue resolved. But for those of you in the self-insured market, there is a path, and that is, the good news is your employer is not mandated by state law, so they can voluntarily add these benefits. And we have toolkits to help you ask your employer for those benefits. We have lots of research that can help you make the case. We have resources that HR professionals can use to make the case. So I encourage anyone who's not covered by the law to reach out to Resolve. It's resolve.org/coverage@work, or feel free to email me at coverage@work@resolve.org. So, and just to give you a sense, most employers are self-insured. So in a state, about 60% of employees work for self-insured companies. And as Commissioner Conway said, none of these companies are bound by state law. So that's why we have this additional program to help those of you in the self-insured market. And obviously a state law puts pressure on self-insured employers to stay competitive, and vice versa. As more employers voluntarily add benefits, it puts pressure on a state.
I'm going to jump in because I'm getting confused. So let me, and I saw a question pop up. So what is the difference between fully insured and self-insured? And then if we could define small group and large group markets. And then I think we just kind of need to tailor and basically let people know that right now it's just the large group market that is covered. And based on what the commissioner said, we're going to have to run a bill in January. to ensure that. And so it's actually going to push out the effective date until probably the new enrollment date in July of 2022. So, but if we could just walk through, and maybe I'm the only one on the call that needs to know those differences, but I actually, this was getting confused on fully insured versus self-insured.
Oh, it's incredibly confusing, right? And it's everything, it's everything, I swear to Christ, everything that we do in the health insurance space and the healthcare space in this country makes it more complicated than it needs to be. But so self-insured is exactly what it sounds like. So it's the employer acts as effectively the insurer. They're not a licensed insurance company, but they're so the employer is taking the risk. There's lots of different types of self-insured products that are out there. Don't need to get into all of the weeds related to that, but that's effectively the idea. And those are governed by, when you hear us talk about Erisa, that's a federal law that was passed back in the 70s. The Employee Retirement, I don't remember what the I, the S, and the A. The A is probably Act, but I don't remember what the I and the S are. But it's a federal law that effectively preempts the states from being able to do anything with the self-insured marketplace. And Betsy's absolutely correct. One of the many reasons why it gets confusing is because United, Cigna, Aetna, right, that you're going to see those names on your insurance card. So you think people think that it's an insurance product that they have, and it's not. It's their employer that's actually insuring them. The fully insured marketplace, when we talk about that, what we're talking about is so a true insurance product is what you have as to kind of actually cover your healthcare. So that, again, it's the Uniteds, the Cignas, Friday Health Plans, Bright Health Plans in the state. Really, it tends to be more focused on the individual market, the small group market, which in Colorado is employers that have 2 to 100 employees. And then large group market too, but it tends to be in the large group market, the fully insured space tends to be more municipalities and school districts, kind of government entities. For a variety of different reasons, they tend to like the safety of a fully insured product. So that's the very, very kind of basic split between the two markets. In Colorado, what we typically kind of talk about at a very high level is that our market is essentially broken into thirds. You've got a third of the folks that are in Medicare and Medicaid, which that's higher now because of the pandemic. We have more people in Medicaid. A third of the market is in fully insured products that we as the state regulate. And then the final third is the Erisa market, the self-insured marketplace. Those numbers fluctuate, they move around from time to time, but that's the kind of the general breakout that we talk about when we get into these issues. So is that helpful, Representative?
Thank you, Commissioner. And then another follow-up question regarding that answer, and then an answer from earlier is just to confirm, it came through from Amanda. So thank you, Amanda. To confirm, if your insurance card does have DOI and the number on it, then the company would be mandated by state law to have this coverage. Is that correct or incorrect?
So that's going to be, so if it has the DOI on it, we regulate the plan. But because of the different components of the one, that this isn't going into effect in the individual and small group market because the feds have written and told us that, and because then the interpretation that Representative Tipper was just talking about, that's going to really require us to run a cleanup bill quickly in the session. It won't go into effect in the large group market until that cleanup bill is signed by the governor and the effective date, wherever that lands in the legislation. But Crystal, kind of to your point, to your question from earlier, I don't want folks to worry about whether they have a plan that's covered by the state law or not, because it gets really confusing really fast. What folks should just call my office, and I'll put the information into the chat. You can call our office and we can help you figure that out once the law goes into effect. Kind of navigating the world of health insurance is way too complicated. So that's why we're here.
Mm-hmm. Resolve is also planning on doing a video to help patients understand, and providers, that can also be shared with HR departments to make sure that they understand if they are subject to the new law as well.
Thank you
Just
both
add
for
one
being
more.
available.
Yeah, I was just going to add one more thing related to what Betsy just said. I think, you know, most of us on this call are not used to taking no for an answer. And we will continue to just push forward, I think, in every way that we can. And I think, you know, it's been really disappointing to see. In some ways, it feels like this legislation has really gotten gutted. But what I want people to take away is that if their employer says, no, we're not covered, don't stop at that. You know, Resolve has a great toolkit. I think the more employees communicate, I saw, I don't remember her first name. I think it was Miss Gallego say, like, she doesn't want to leave the state, but it's more important for her to get coverage. We do hear that. And it's the reason that some employers that are self-insured are actually taking the proactive step to get this. So continue talking about it, continue pushing your employers, continue reaching out to groups like Resolve, because it's definitely a village effort. I mean, it's going to take all of us really pushing in every way possible to try and get this coverage to affect as many people as possible.
Yeah.
Definitely. Thank you, Representative. And to tagline off of that, Betsy, since you do have, or Resolve rather, has a gigantic database of resources and what coverage is available state by state, something I'm not sure if Resolve has, but I would like to pose to you, and then maybe Commissioner, if you have it as well, the question about how can we find out prior to taking a job offer whether our insurance will be providing this coverage or not? Is there any type of database or resource where someone who is looking at new employment specifically for this coverage would be able to reach out and find out about specific employers?
I would suggest that they need to request a copy of the benefits and read it very, very carefully. And, you know, if there's any confusion, it sounds like the commissioner's office is a good resource. Resolve can also help. So you do want to make sure that it will cover you. I'll just give an example. Some policies may still use a heteronormative definition for infertility that leaves out the LGBTQ community, which of course our legislation was inclusive. So you do want to read it very carefully before assuming that you're covered.
Yeah, and Crystal, it's an excellent question that I don't have an answer for right off the bat, which isn't very often the case. But going into employment, I think Betsy's generally right that you're going to need to ask the HR department for a copy of the policy that would be covering you and see if the coverage is actually in there.
Thank you both. And then so as Commissioner and Representative Tipper have led to, there is going to be a cleanup bill that is going to be run because of some of the language that was written in the original bill and the Attorney General's interpretation of that. So the bill is going to be run next session. And Commissioner, if you can address the language specifically from the original bill, and then the idea of this cleanup bill and what the cleanup bill would be addressing specifically, and then a timeline for that and what the intention behind any potential delays in coverage would be, that would be great.
Sure. I'll let Rep. Tipper handle the legislation piece because we're trying not to get out in front of our skis in front of the legislators. But the language issue. So as Betsy laid out very well at the front end of this, the defrayal issue only applies in the individual and small group market, right? That's the only place where that potential issue could be in play. The language that was written into the bill essentially says that if the federal government comes and tells us that that the state would have to defray, that the law wouldn't go into effect. Because the language isn't clear enough that only applies to the individual and small group market, which is a bit of I think you could argue that it's a narrow read of the language, but the Attorney General's office just didn't think that the division had the authority to implement a regulation, to promulgate a regulation requiring it to go into effect in the large group market without that cleanup bill. So that's effectively where we kind of find ourselves, Crystal. As far as the effective date, so with the original bill, it was intended to go into effect January 1st, 2022. With the cleanup bill going into place, there will be a delay of the implementation in the large group market. I think it's just a matter of what the legislation sets forth of when it would be able to actually be implemented after that. There's two general timelines that plans tend to either issue or renew, and those are important terms in the insurance space, because any new law that goes into effect, it can actually go into effect in the plan until the plan is either issued, so it's a new policy being written by the insurance company, or it's renewed for the insurance company. So those two dates tend to be, and these are just general kind of rules of thumb. It's not hardly written out there in any stretch of the imagination, but those two dates tend to be July 1 and January 1. So for those four companies in the large group space, that would be my expectation for the most part. It would be July of next year and then January of the following year when a plan is either issued or renewed. As far as the individual and small group market is concerned, as Betsy talked about, those conversations are still ongoing at the federal level. There's hope that the Biden administration will change the interpretation that was put out there by the Trump administration as to whether this is a new mandate that would have to be defrayed. And I think that there is some hope that this regulatory scheme that's out there could go away. But like I said, that they haven't given any indication, at least to us. Betsy, I'd be really curious if you all are hearing kind of through your work, the regulations might go away. But if they stay in place, we're going to have to work through with the Biden administration to work on the individual and small group market.
Yeah, we're still hopeful and want to have conversations regarding that. And no state had been in the past required to defray, even though they have passed similar mandates in our space and for other diseases. So we are trying to get some clarification from the federal government, and fortunately we were able to get some corporate support to retain federal lobbyists to help us with that, but that's still in the very early stages, but we're hopeful.
Thank you both. And then Representative Tipper, would you mind commenting on the legislative timeline and the process regarding the cleanup bill?
Sure. So as of right now, the bill goes into effect. Basically, the way that we had written it was for it to apply to all plans issued or renewed on or after January 1st, 2022. So as the commissioner said, the Attorney General, who is the lawyer for the executive branch, has said, you don't have the authority to move forward with implementing this bill. So that means that the Division of Insurance is not going to move forward until we make the change in legislation. It would be a pretty, I think, really tailored bill. It's not going to be the full court press that we did for this, because really what we're saying is, General Assembly, you passed this legislation. There's a hiccup, and we want to basically give full force and credit to the intent of the legislation, what you have already, sanctioned with your yes vote. So my goal, I think the hope is to run a piece of legislation very early in the session. So we gavel in on January 8th. So my hope would be, it would be a very early bill. We have support from the governor, from the executive branch, of course, Division of Insurance, and the commissioners on here. We have our sponsors. And so as soon as that could move through the legislature and get signed by the governor, it would have to happen before May 8th, which is when we adjourn, but I would expect it would be in the first couple months of session. We would put what's called a safety clause on it, which makes the bill go into effect right away. But for the reasons the commissioner talked about, the bill would go into effect, I think that would mean that the commissioner could probably start with rulemaking with the goal of it applying to plans that are issued or renewed on or after July 1st, 2022.
Thank you, Representative Tipper. All right, so Betsy, if you wouldn't mind addressing this next question, it's regarding some other bill language. So regarding one of the key provisions in the bill, it's regarding ASRM's guidance, and there is a couple of questions that are, it's a twofold question, a couple of points regarding ASRM's guidance and whether specific procedures like ICSI or surrogacy and other specific procedures would be covered, or who determines what is ASRM guidelines and what procedures themselves are covered.
Okay, that's a good question. I wish someone from ASRM were on, but basically, if something is being is considered medically necessary by your physician, there is sort of that third bullet saying if you need this based on your physician's findings or diagnostic tests, then it should be covered. Surrogacy involves third-party reproduction, so that's a little tricky in that the procedures are often taking place on someone who is not on the patient's policy. So that is not, would not be covered based on the language of the bill. You know, perhaps when we do this cleanup, we might be able to do something like that, but we don't want to do anything that just jeopardizes trying to get the coverage that was intended. But again, you know, when the regulations are or the rules are issued, it should give, you know, the physician and the patient sort of, you know, that's where the decisions are supposed to be made. What's most medically effective? And so that's why it's important that the rules are clear, because otherwise the insurers will come up with their own clinical guidelines. So that's why we have listed ASRM as the guidance, so that the insurers are not coming up with their own that say you need to do 6 rounds of IUI before you can move on to IVF and things like that. Did that answer the question?
So there are a few people who asked varying versions of that, but if anybody else has any follow-up questions, please make sure to use the chat box and we'll readdress that question. One of the questions that has come up is who actually benefits from this law. So I want to make sure to read Representative Tipper's comment in the comment box so that we can be clear on that, because it was very direct and honest with that. Is right now employees who work for large group employers, which is 100 or more employees that aren't self-insured. So again, this is a bill that was written for the large group markets because of HHS's response, and therefore eliminate the individual and small group markets. So one of the follow-up questions to that is, what can we do? And Betsy, I'll direct this to you because it's definitely a bigger picture item outside of just Colorado, is what can we do to ensure that we continue to push for coverage for those people who are not impacted by the Colorado Building Families Act?
Well, I think it's important to get involved at the federal level and the state level. So we have a Resolve Advocacy Network. I'll put that in the chat too, so that you'll receive the latest information on this new legislation, but also what's happening at the federal level. And honestly, usually federal and state don't intersect much, but in this case, it does. And so, you know, at our recent Federal Advocacy Day, we did have the Colorado delegation bring this up. So, you know, it's important for federal lawmakers to know that this provision within the ACA is having an unintended consequence and not allowing states to keep up with medical advances. You know, treatment wasn't supposed to be frozen in 2011. So, and then once we have the new legislation introduced, we'll have a better sense of what needs to be done. But I think, and Representative Tipper, correct me if I'm wrong, I think every lawmaker would want to know how disappointed their constituents are that this is not covering them as the legislature had wanted it to. So I mean, we would always encourage people to let their lawmakers know how they're feeling about this.
Absolutely. I mean, I think that's actually incredibly important because particularly for an issue like fertility, which is private for a lot of people, you know, I think we benefited from people sharing very difficult stories, and it touched hearts and minds in the legislature. It's the reason it was bipartisan, particularly in the House. And frankly, I'm going to really be leaning on some of my Republican counterparts to try and fast track this technical fix. To a certain extent, legislators are all sensitive to, you know, successfully passing a bill and then only to realize something comes up afterwards that has to be fixed. Like we have either had that happen to us or know some, you know, work with someone that has. So to me, that's actually one of the most important things that you all can be doing is, you know, I've had almost 1 to 2 emails a day on this bill. And most of the individuals have been expressing frustration upon realizing that they're not going to be covered and that they had waited, you know, for the effective date of this legislation. I was talking to someone earlier today, and like waiting and fertility just don't really go hand in hand. You know, that's the cruelty, is the financial barrier forces people don't have a choice. They either have to wait or forego it altogether. And that was part of what we wanted to try and address with this legislation. So please make sure your state legislators know how important this is. And even if it, you know, knowing that it's important to get it to the large group market, but important to you if you're not in the large group market, for there to be continued push and efforts in this space. Yeah, and I see people seeing, I mean, frankly, I'm, you know, I would be affected by it as well. I have the majority leader that's on here as well. So I'm sure she probably wouldn't mind me saying she availed herself of IVF. I mean, this really touches personally to a lot of us that are in the legislature. And what the testimony did on the bill was it made people that maybe didn't realize they had family members or close friends that were affected by infertility, you know, in their lives, it exposed that. And so we had a lot of brave people that came forward and told their stories. So yes, contact your legislators.
Thank you all very much. And then one of the things I'd like to also point out is that a past CFA webinar a few months back, we actually did and Christina just posted a comment that triggered this thought, but we did a webinar on asking your own individual employers. So I know the frustration. I mean, I personally have 2 IVF babies. I fought against federal regulation because I also didn't have insurance, and my husband was wounded in the military, and everything, his medical care was covered except for his ability to have kids. So that's what got me here. That's what started me here. And I can attest to that as well. One voice does speak volumes. And I want to definitely point out that CFA's webinar a couple months back was regarding how to talk to your employer. So all of you who are in the individual market, the self-insured market, make sure to talk to your HR. Check out Resolve at Work's resource, check out CFA's webinar. It was a fantastic webinar, and we're already getting positive feedback about people who have used the resource and used the information gained from the webinar who actually have been successful in getting their employers to implement coverage. So don't take the fact that your market isn't covered by this law, as Representative Tipper said. We're not usually good at taking no and just sitting with it. So don't take that no and just sit with it. Make sure to reach out to the resources. Commissioner Conway put his information up there. He's a fabulous resource. Representative Tipper herself, also having gone through IVF and run this bill and run the process, very passionate about family building. Betsy put the information in there. Just definitely make sure to reach out to CFA, our website as well. There's still resources. Don't let this, and as Representative Tipper said, I know it's frustrating because timing and infertility don't usually go hand in hand. And I mean, I can speak from very personal experience about that and understand the frustration, but definitely everyone who is on here on this call is a resource. Reach out to all of us. We are going to continue to fight for all of this and make sure that everyone possible has the coverage that they need. So watching regarding that, there was a question that came up, where can we watch the webinar from the spring about talking to your employer on the CFA website? Yes, it is. And Judith, thank you very much. Just posted the link in the comments here. You're quick. I appreciate it.
And I'll just add, we're already hearing from people who watched that webinar and made a successful ask. So it really does work. So we look forward to working with anyone who wants to make the ask.
Definitely. So going back to, and again, I know ASRM isn't on the call, but Betsy, if you could do your best to answer this question as well. There were a couple follow-up questions regarding ASRM, the verbiage in there and what is or isn't covered. So we talked a little bit about ICSI, PESA, that kind of thing. So those would be considered medically indicated. But does that also extend to egg donation, sperm donation, and any other donated gametes?
Yeah, I do think there could be issues with the cost not being covered to procure the donor gametes, but that the process itself, the cycle itself, should be covered. I think actually we should probably suggest that, you know, the clinics have a lot of experience and they have patients with all sorts of insurance policies. And so they also are experts on what is covered and what is not, even before this new law takes effect. So I would rely on those insurance experts at your clinics to find out exactly what is covered. And, you know, we do know of, you know, insurers that will deny something and then they reverse it on appeal because a physician says, look, this person needs it because, you know, they carry the BRCA gene or whatever it is. So, you know, I would lean on the clinics who have experience working with insurers. And then as the rulemaking it takes place, we'll make sure that we try to be as comprehensive as the law allows.
Thank you, Betsy. And then there was also a question about medication coverage. And I just wanted to address that really quickly, that medication was specifically written into this bill. So medication will be covered. And then again, as Betsy mentioned, speak with your insurance plan. It does have to be through a covered pharmacy and things like that. So make sure to speak with your insurance plan, speak with your clinic, and they'll help you find a clinic or find a pharmacy that would assist with the medications, because medication is specifically written into the coverage law.
Hey, Crystal, I just wanted to add in terms of expectations. So let's assume you're in the group that's large group market and it's July 2nd, 2022. We know it applies to you. Know that the coverage is parity. So it is dependent on the type of coverage you have, right? So if you have, I would assume, you know, a high deductible plan, the same thing is going to apply here. I mean, shoot, high deductible plans might actually work really well for IVF because it's so expensive. But so keep that in mind. And that just made me think of the prescriptions made me think about that, because I was really surprised to find my husband's employers in Massachusetts were insured through them. We had really excellent prescription benefits, and those applied for IVF drugs. And so, you know, what some people cost $10,000 for us was about $300. So it was a huge difference, a huge impact. That could, of course, swing the other way. So keep that in mind in terms of expectations. And maybe if you are waiting and you do have the time and there's an opportunity to sort of reevaluate the type of plan that you have in January, you might consider that, because that's the type of coverage that you're going to get for IVF or for fertility, not IVF specifically, but you know what I mean.
Mm-hmm.
It's more than IVF.
Thank you, Representative Schiffer. And to clarify what she means by parity is basically it was written into the law that insurance plans couldn't create a different pay scale or a benefit scale for any type of reimbursement, any type of co-pays outside of what your plan already covers. So whatever it charges for medication for your normal plan, IVF has to fall under that same co-pay scale. Same thing as visits and co-pays. They can't just make up a new dollar amount that they want to use as a copay or a cap or anything like that.
And Crystal, I guess it's worth repeating that the coverage is at least 3 completed egg retrievals and unlimited embryo transfers, plus fertility preservation services for those with a medical condition or who are at risk of medically induced infertility from a medical treatment like chemotherapy or radiation or medication therapy. So the benefits are, you know, we know that often it may take up to 3 attempts. So we tried our best to make sure that there was enough coverage to resolve one's infertility.
Thank you, Betsy, for clarifying that. So it looks like we have addressed most of the questions in the chat box and all of the questions I received prior to the webinar. Just one just came through, but if there's any other questions, we have about 5 more minutes left on the webinar. So make sure to enter those questions into the chat box and we'll do our best to address them. And then also make sure to check out the information for Commissioner, as well as Betsy typed in some information for Resolve for a follow-up as well. So the question that just came through, or a couple of them, would the parity apply to their current plan in 2022 and possibly change the next plan year?
I'm not sure. So I think the answer to that question is no, if I'm understanding the question correctly. So the parity component is going to apply once the law goes into effect across the board. So it could be the case, yes, and it is the case quite often, that employers and insurance companies will change what we call cost shares, so deductibles, co-payments, co-insurance from year to year, but the parity piece of that will apply, the parity piece of the law will apply going forward, no matter what those kind of cost shares are. But if I didn't actually answer your question, please jump back in and let me know.
So Cindy, if that didn't answer, make sure to let us know. And then a couple more follow-up regarding timelines. So one question asked about, will fertility medication be covered under the mandate starting in January 2022? And then also, will this sorry, the screen keeps shifting. Will this mandate go into effect in July 2022, no matter what insurance carrier you have, or will it be only specific carriers at that time?
So as we've talked about, the law is going to go into effect once we get the cleanup bill kind of through the legislature. So I kind of hesitate to tell you a definitive date of when that will be, simply because you never know how a legislative session is going to go, and we don't have the language of the law quite yet of the cleanup bill. But it is it's the movement, as Representative Tipper kind of talked about earlier. The push is going to be to get the bill through as quickly as possible. And then it will be most likely the case for the large group plans that the first time that your plan could issue or renew will be that July 1 date that I talked about. If your plan doesn't renew though until January of the following year, it won't go into effect for your plan until that renewal kicks in. And that's, again, federal contract law that would put everybody to sleep except for maybe Representative Tipper. So I won't get into a great level of detail, but there's just federal issues that come into play on that front too.
All right, so we've got time for about 2 more questions, which I see in the chat box. The first one saying, let's say your insurance applies. If you have already maxed out or close to maxed out your current lifetime allowance for fertility help on your insurance plan, would that matter when this law starts to take effect?
So that sounds like it's a self-insured plan that has some level of coverage for fertility already. In the fully insured market where the ACA laws and rules apply, you can't have lifetime maximums for any coverage. So that wouldn't be in play for this product, or for this benefit rather.
Thank you for that clarification. And then one final question, and then we'll do a couple of closing comments, but carriers are not required to cover genetic testing. This is again regarding what the law will be required to cover under the ASRM guidelines. So if your doctor recommends pre-implantation genetic testing or any other DNA screening, will the coverage be required to cover that?
Betsy, I'm going to let you take the first shot at that
Yeah,
question.
you know, it should be in a perfect world. And I guess that I would want to, you know, we defined that, you know, we tried to define it in a way that gives autonomy to the professional to determine what is best and most medically effective for the patient. So that would be the goal. You know, and so I guess, you know, I don't know, Commissioner Conway, when we get down to the rules, whether we get down to that level of detail or not. But we always encourage people that even if something is denied, appeal it, because you know, if there's a medical reason for doing something, then, you know, insurers should be covering it. I mean, I know that doesn't happen in any, you know, in other situations either, but I guess, you know, that's something I think that we'll discuss more. And if there is tighter language that can help that, then we'll explore that. But again, I would also, you know, talk to the insurance experts in the clinics to find out what you know, what sort of policies have covered this, to make sure that you know, it can be coded in a way that it gets covered.
So Betsy's absolutely right on the appeals piece. Take advantage and use your appeals rights whenever you are denied by an insurance company for something. And then as far as kind of the level of detail on that question, candidly, I don't have the level of expertise to be able to answer it. But it's not likely the case that we would get into that level of detail in a regulation. It's just not something that we would typically dive that far into, but certainly happy to have conversations as we get there.
Fantastic. Well, thank you everyone for joining us tonight. Thank you, Commissioner, Representative, and Betsy, for spending a little bit of time this evening with us and for sharing your contact information, for sharing your resources, and being available to us. As we all know, we are all very passionate about fertility treatment, fertility access, and we appreciate all of your time, your guidance, and your support in helping get this bill passed. And we look forward to hearing more about the cleanup bill, Representative Tipper, and we look forward to continuing to serve you through Colorado Fertility Advocates as well. Make sure to check out our website and our social media to continue to stay up to date with the bill, as well as any questions that you may have. And the webinar will be posted on the website as well for those of you that weren't able to join us tonight. So thank you all. Have a great evening.
Thanks, everybody.
Thank you.